who might be joining us online to listen or who watch this later, and those of you who are in the audience, a reminder that work sessions are for informational purposes only. We do not take public comment at this time, but we do have a business meeting following shortly after that will begin at 5:30, where we always have a general public comment section near the beginning of the meeting, and you're welcome to provide any feedback you have then. Otherwise, I will turn it over to Jill and let her introduce our guests and topic for today.
Yep. Thanks, commissioners. You're going to get some information today related to one of our initiatives in the Anti-Poverty Community Health Improvement Plan. You heard from us a couple times last year about the grant opportunity that we were able to participate in through the International City County Managers Association for their Economic Mobility Initiative. We received that $25,000 grant, and with that grant funding, we were able to engage University of Kansas Centers for Public Partnerships and Research. Specifically, there are tomorrow's project team to capture some lived experiences, some qualitative and quantitative data on the priority population that we've selected in our in the Anti-Poverty Community Health Improvement Plan. So today you're going to hear about the summary of that project, the report, the findings, and then you're going to hear just some reflections from some of our partners that have been on the project team that also work directly with our priority population, with a lot of families that that we're all working around trying to have go from survival to into that thriving zone. So I'm going to let Brett start with introducing himself, and then we'll end with Jenny and let her kick us off.
Good afternoon, Brett Martin with United Way of Kaw Valley.
I don't need him. I can talk loud. Oh, okay. I am Kim Spencer, Director of Compliance with DECA.
Paulson, Executive Director. Kim Paulson, Executive Director, Community Children's Center.
Hi, I'm Jenny Bernard. I'm the Executive Director for Live Well Douglas County, and I serve on the CHIP Steering Committee.
I'm Jenny Welch-Buller, and I'm a Research Project Manager at the Center for Public Partnerships and Research at KU, and I'll be giving us the presentation today. Thank you for your time here today to share some information about our project, our shared project. I'm going to go ahead and share my screen. Let's see here. And see if that gets going. Okay. So I'll start by walking us through a little bit of the project background and the results, and then I'll hand it off to the team to, as Jill mentioned, share their reflections and next steps. So the goal, let me arrow, there we go. The goal of Douglas County Thrives is to place community members, their stories at the heart of meaningful dialogue and action planning. We also hope that the information that we share with you today and what's in the report can help inform decision makings at the county level. So the Anti-Poverty CHIP team partnered with KU CPPR back in August to develop a survey, collect some stories, and conduct community sense-making sessions. And the focus was on the experiences and needs of the anti-poverty CHIP priority population, which is single female-headed households living at or below the ALICE standard. And for those who aren't familiar with ALICE, it stands for Asset Limited, Income Constrained, and Employed. And this effort, as Jill mentioned, was made possible by Douglas County's International City County Management ICMA 2025 Economic Mobility Opportunity Cohort Grant. It's a mouthful, but a great opportunity. Community partners here at this table and some who are able to be here today, and of course, all of those who shared their story, which we'll get into in a moment. So I want to share just very briefly to help frame and provide some more context, the timeline that we were working with. So in August and September, we worked together as a team to design a survey. We did some planning around the goals just to make sure it was meeting the work project's goals. And then October through November, really hands-on effort from our community partners to collect stories from across Douglas County and organize some events. And we staged those events to take place in in the order of starting with families who have lived experience and who may have shared their experience to help guide and make sure and validate our approach that we then took to the broader community at the LEAD Center. So those took place in December. And at that first one really was, again, have to give credit to our partners as at the Community Children's Center, Kim Spencer. Thank you for helping organize that and bringing people, DECA, to name just a few of the partners who helped organize that. And then, of course, the LEAD Center. I think some of you were there as well. They were about an hour and a half long, and I think we had about 50 people at the second one. So then January, we spent some time compiling the outcomes from the sessions. And for those who were there, you may recall putting a lot of your ideas on sticky notes, meeting in small groups to talk about what you were discovering together, and then having some share outs together. So that, along with note-taking and observations, compiled what some of the findings are that we'll share today. Okay, oops. There we go. Just wanted to highlight again, I can't say enough about our partners who made this possible. And so this is a list of just, well, pretty extensive list. Forgive me if I missed anybody. But on the side here too, we just wanted to share a snapshot of one of the flyers, some of the outreach methods we used. We had Spanish and English flyers, and the survey was available in Spanish as well. And participants could take a survey online on their own time, on their phone or on their computer, or we had paper versions. And then we had some of our volunteers station themselves in a lot of where the target population, our participants, frequented in order to gather stories. And so individuals could share a story by conveying that to a story collector, or by writing it on the paper, or taking it online.
Right, Jennifer, you mentioned going on location. What were some of the locations you used?
Just Food was one of them, and I could probably turn to the partners to gather more insight into where they collected stories. I know some went to Just Food and DECA, and any others?
I know Live Well, we partnered with Just Food to help coordinate. So we had days where we were tabling there as people would come in to collect food resources, and gave them an opportunity if they wanted to share their story and participate in the survey. And then all of our participants were compensated for their time with a gift card using the grant funds.
Thank you. Thanks for that.
We made sure that there was an opportunity to collect stories at our Grow and Go parent-child engagement sessions, our open plays, and within our early childhood clothing closet.
And DECA worked with some of the women at the women's residential facility First Step at Lakeview that have children there with them, as well as some of the women in the outpatient program.
And Heartland Community Health Center, they deployed virtually all of their community health worker team members to be engaged in this work, and in all the different places and spaces that they show up.
Thanks, everybody. Thanks for that question as well. I wanted to back up. I think I missed a slide, just talking a little bit about the approach and why we took this approach to help complement and supplement some of the ongoing data collection efforts that the group has done. So the community sense-making approach, the Our Tomorrows community sense-making approach, starts with a survey. It's really designed to help communities address complex social problems that may need community narratives or insights to help address some of the things that are really hard to unpack. So it begins by inviting participants to respond to an open and rather broad prompt, so that we try to avoid making any assumptions about what is important to them at that moment. And then participants are invited through a series of multiple choice questions to tell us, the researchers or the community members, what is important about their story, to kind of remove some of that potential for researcher bias. Again, just one approach that tends to work well with some of these more complex challenges that families are facing. So then through those series of questions, they essentially code their own experiences, and then we bring those patterns and stories to the community members to help make meaning of them together. And again, some of you may have been there and helped contribute to that process. So we co-interpret the data and develop actionable insights, and that is a little bit of what we'll share with you today. So this is the story prompt for this survey. Think about a moment in the last year when you felt like your family was really thriving or just surviving. what was happening at the time. Tell us about that experience in the space below. So that is pretty broad, right? So we got quite a rich selection of stories from this, and part of that again is attributed to a lot of that organizing grassroots efforts that our partners took. So who shared their stories with us? In just 2 months, our partners collected over 94 stories from across Douglas County. We did really make an effort and included zip codes on the survey to ensure and help us understand the breadth of stories that we got. And about 40% identified as single parents, 72% were identified as female. We asked quite a few identity questions. These are just a few examples of for the presentation today. And all of the participants said that they made under about $75,000 a year in terms of household income. 62% identified as low income or said that that was important to their story. And I wanted to highlight too, we broke down the income to help us try to understand a little bit more about the ALICE threshold I mentioned earlier. And over a third reported household incomes as low as below $10,000, which is fairly significant. And then well over half said they earned less than $30,000. 46 to 50% said unemployment, mental health challenges, and food insecurity were a major part of their story. We have many other situations that folks identified, but these were the top 3. So
I have another quick question, if that's right. So in your prompt, the broad prompt, you asked about, times when they're thriving and times that are harder. How many of those thriving stories did you get versus the challenge stories?
Oh, that is a great question. So we did ask a question whether or not the story was positive or negative. So we don't directly ask if it was thriving or surviving. I will say that through my personal observation and through what I heard in the community sense-making sessions, people noted a lot of strengths, even amidst some of the stories that were highlighting some of those just surviving. I think the majority was just surviving. And there were, again, what we might consider bright spots or positive strengths about the community or about their own family within that showed that. But we are careful to then look to their coding to say whether that was a positive or a negative experience. So that's something we could break down later. Yeah, thank you.
Did you ask about educational level?
Oh my goodness, I don't think we did in this one, but I will get back to you all. That is a great question. Thank you. Any other questions? Okay. I also want to mention too, before I move on, that some of the other challenges that people picked out in the multiple choice section were 34% struggled with housing instability, 36 had transportation issues, and substance use disorder or addiction, 27%. So those were the highest. After that, special health care needs, criminal records, debt and bankruptcy, and domestic violence were kind of among some of the higher challenges that folks identified as key to their experience or story. And when asked what made a difference in the last year, quite a few, about half, nearly half, said SNAP or food assistance, food banks, and utility assistance were really key to helping them in the last year. Okay, I'm going to move to the next slide. So I did want to share just a few stories. I know we have limited time, but for those who weren't able to be at the sense-making session, these are the heart of what this is about. And so I wanted to highlight a few of those. In this story here, the cost of affordable, I wanted to mention that this one, we found this story in a pattern near when asked, what does your community need more of? They said we need more direct assistance given to a family. So that is the lens through which we began looking at the story in our sense-making session. I'll just give folks a few minutes to take a look at this. Okay. I should also mention that part of this survey experience is inviting participants to title their own story or experience, and we gain meaning through that. Sometimes it can take us in a different direction or show them what was top of mind. So in this story, a single mother trying to provide for her children, #grateful, that keeping in mind, this is the title that was given after they shared. Talks about losing your job, some things that worked well, and services that helped them. But also we find some of the struggles in there as well.
You also mentioned the collection of zip code data.
Yes, yes.
I'm not seeing that in the slides.
Oh, correct. Yes, I can grab some insights into that out of the appendix. Let's see here.
So I'm just kind of curious, out of the 94 respondents,
Yeah.
where they come from across the zip code.
Sorry about the page noises and the mic. Okay. 43% were from 66044. 24% were from 66046. 13% from 66047. 15% from 66049. And then we have just a story here and there from across 4 other zip codes. So I can follow up with those in the report. They're found in the appendix on page 30 or 26.
Yeah, it's in the agenda packet. We have that full report with the appendix just for future reference. But
you.
thanks, Jenny.
So with 94 respondents, I assume the ones that are 1% are like one person. So we had one person from Baldwin, one person from Eudora, and one person from the Edgerton area, but we didn't have anybody from Western Douglas County. Just to get that.
I trust you on that one. Thank you. Yes, correct. Okay. Here's one more story before we move on to, really want to get to the session outcomes so that we can share a little bit about what actions folks recommended. So here we have a story, I think to your point, of asking about just surviving or thriving. In this case, they call that out directly. So this is a story about just surviving and struggling financially. And we do have, this also references something that came up in the sense-making sessions about stigma. So that was a concern that a lot of folks had when considering ways to help families in Douglas County, stigma still being a prevalent theme that we found. Okay. I also just want to give a quick glance at what I was talking about when I was talking about those multiple choice questions that are a little bit different than the average survey. So here on the left, we see a question that is designed to ask people to look at a point on the triangle and place their story, tell us, for instance, when I think about what's available for families in my community, we need more services or program options, people to help or providers, and resources given directly to families. So the way we used this pattern was we saw that there are quite a few stories that were gathering in the section near resources given directly to families. So we single parent families, to be specific, which are the yellow dots. So we pulled stories out of that section and brought them to the group for discussion. And then similarly on the next pattern, the way we used this pattern was to just explore our curiosity with community members and families to ask each other, like, what might it mean to look at stories that are closer to immediate or emergency needs versus long-term support. This led to some discussion about what would it mean if we had more stories near long-term support? How might they look different? And so we took a look at some of those stories. So now we're going to talk about the exciting part, session outcomes, and what we learned in our 2 community sense-making sessions. So first, in each session, actually, we ask participants to reflect on some of the demographics like we did moments ago, and then we invite them to look at the patterns and stories, and we have a series of discussion questions. We always want to ask what stands out, what is a strength, and also we talk about challenges, and some of those are interwoven, and as noted by our sense-making participants. So when we asked for them to reflect on the data and the patterns and the stories, overall, we heard that financial strain and economic pressure underpins most of the issues. This involves challenges with income being unstable, also not able to help families meet the cost of living. And they talked a little bit too about how when earning more, that triggers a loss of supports before stability is achieved. So that came up in the stories, but it also came up in some of the experiences shared during our community session. Structural barriers came up, and when I refer to structural barriers, that's looping together the challenges families are facing with eligibility rules, application hoops, fragmented systems, and they talk about how those experiences in the stories and the people who reflected on the stories talked about how it really is very time consuming and difficult. And while they talked about many of the strengths in our community and how many people and how much support there was, that sometimes just the act of navigating through the processes and finding the right fit can be very challenging when trying to also work sometimes multiple jobs. Housing barriers and affordability came up. Some of this, though, related to challenges with credit. And someone, for instance, mentioned when we learn about credit, it's too late. So there was that kind of a loop there that folks mentioned, and credit checks. And then also they discussed some quality concerns and talked about how housing both reflects their challenges financially, but also drives instability. So both kind of cause and effect of challenges with income. Basic needs came up as a major challenge, and food security, and families talked about, and the session participants observed through the stories that it often takes patching together multiple solutions or resources to meet a family's needs, and that sometimes, for instance, there are creative solutions to working with a food shelf while also working with the family's dietary needs, or making sacrifices in order to patch together the local solutions. So, and again, stigma came up quite a bit when it came to seeking help for basic needs. Overall, this and threaded throughout when through the sessions, the emotional toll, kind of the stress of the instability came through. But what really stood out through the sessions was that there was some discussion about the resilience of families in the stories, but that was paired very closely with the discussion about how it is important to note that the stability and basic needs could go a long way to addressing some mental health challenges that people face. So the next few slides just go a little bit deeper, but I want to do a time check real quick. You doing okay? All right. So here are just a few quotes to kind of illustrate some of the topics or themes that came out in the challenges. So to spend a little time here, in terms of the financial stress, I know I talked a little bit about that already, but it really came down to financial choices and difficult choices. And we heard stories, and we heard communities members share that oftentimes families are employed full time, but living without a safety net or a buffer. So that adds to that stress. Benefit calculations came up quite a bit, how they didn't quite match the realities that families are experiencing. And while some of those were noted at the federal level and difficult to work around, it was still a challenge that came up. Okay. Also, I think important to note, I wanted to mention this came up quite a few times, that how the earning more, so the economic mobility, which is a lot of what this project is about. Some families shared, it prompted their own experiences about sharing how even when earning more over time, it can result in losing stability or safety net before stability is achieved. So there was a discussion about, I think sometimes we refer to it as a benefit cliff, but it was spoken in real lived experience terms, just sounded like I think that's where this quote really hits home. Okay, structural barriers. Again, whenever some of these challenges were mentioned, it was often paired with a strength or a positive experience. We know they're helpful. We often seek help, but since you're asking, these are the challenges we observed and these are the challenges we experience. Finding the right fit came up quite a bit. And also, again, the note about credit. Okay. All right. Emotional toll, just a little bit more. I wanted to share quotes. And just a quick note, these quotes are from sense-making sessions. So again, reflections on making meaning of the stories that we read. So, okay. So now we're to the ideas for community action. Just a few slides left before we open up for more questions and reflections from the team. So the first thing, again, this is a summary of many of the actions that came out of this session. So increase income stability and reduce cost burdens. And underneath this, you'll see quite a few examples that were pulled directly from the 2 sessions. Direct assistance programs for single parents came up quite a few times, and then identifying opportunities to reduce the cost burden so that folks can continue on a path towards economic stability or mobility. There was also mention of the ALICE threshold as a possible way to reconsider eligibility, since it does include a range of income levels and household structures that are broader than the poverty level that is often used for programs. That includes working families and what's called a survival budget. Simplify access and reduce system barriers came up, and there was a mention of finding ways as a community that we can possibly, again, reduce those eligibility barriers, wait times, and requirements. No wrong door policies came up, and again, advocating for policies that would somehow support the reduction of benefit cliffs and help families stay on a path. So a lot of these you'll see are a little bit overlapping. So when we get to this next idea, strengthening service coordination and whole family design, this is again talking about connecting the dots between agencies, and taking a whole family service model approach. Some of the stories and community reflections talked about family structures that don't always fit the traditional or standards of eligibility. And that came up when trying to discuss solutions for the family. Like, I'm working on a path to contribute to family, and we may not live together, but here's how we want to help be part of that solution. So that came up quite a bit in some of the discussions around the stories. And prioritizing housing stability and affordability for single parent households is another summarized bucket of the actions that came out of the sessions. And some of the ideas, this is where it ties in with credit counseling. Credit counseling came up as a solution to the mention of the challenge with credit histories. That quote that you may recall that mentioned that it's too late. Once I learn about that, it's too late. So fluctuating incomes and wages was threaded throughout. And so we looped this under this bucket because while that isn't necessarily something that has a clear solution, it definitely came up quite a bit as one of the challenges that prevents families from fitting into the service or assistance mode of eligibility or continuing on a path towards stability. In other words, there's a lot of gig work out there right now, and a lot of families are patching together multiple jobs, part-time, full-time, and they don't always necessarily fit the eligibility protocol in terms of the timing when they get paid and how that shows up and impacts their eligibility for the safety net programs. Leveraging lived expertise, I'm going to admit my bias here, came up quite a bit, and the importance of continuing to look to families, lived experts, engage peer supports, and to help build trust across the community and make stronger connections. And one thing I forgot to mention too was coordinated referral systems came up on that first one. So I want to make sure I get some of those concrete examples all out for our discussion. So that, in the summary, is all the action ideas that came up from the discussion and review of the stories. And I'm very honored to have the opportunity, and we hope that these contribute to your understanding of some of the struggles that some of the families have and some of the ideas for action that they have as well.
Would I be right to frame it this way, that the action items, the audience for that is not just us here at the county, but that broad range of partners, both within this conversation and folks who are tangentially related?
Yes, you said it so well. Thank you. Part of the sense-making approach is to ideally folks who leave the sense-making session have ideas for how they personally could even engage in solutions or with more insights into the complexities. But at the end, we hope that the insights and the actions can be threaded throughout different levels of community action wherever and people can see that it can take a place and inform decision-making, policy, budgets, whatever it may be. We hope that these provide some helpful insights. Yes.
I guess kind of a follow-up to that is, how do you get this information in front of other audiences that fall within those partners or nearby?
That's a great question. I can answer part of that, but I think I'll turn to our partners who have a little bit about next steps. I'm afraid I skipped right over your slide. I apologize. I can open that back up. One thing that we are committed to doing at CPPR is finding connections in pre-existing or other initiatives where we could partner and tie in. And so we do have other sense-making collaborations across the state, and we're looking into opportunities to do that here in Douglas County as well. And then we have 94 stories. I think we looked at not even half of those at our sense-making sessions. So I think there's opportunities for the work group and others with the CHIP plan to look back at those and continually be revisiting the stories themselves to see how they might inform, just seed thoughts about what's possible and what's needed and what's important to families who are trying to reach economic stability. So thanks for that question, and I'll open it up to the team.
Yeah, and I think in addition to our organization, the idea with this presentation for you all, for starters, was it was related to the grant, but we hope that this information provides important context for, this organization provides a lot of funding for housing, human services, health services, well-being through our budget process each year. So having this information in the back of your mind about what are those lived experiences in our community, that was one idea. But largely we hope that this report will help continue to support the work of the Community Health Improvement Plan, not only for our anti-poverty focus area, but you heard that there's cross-cutting. It overlaps into other parts of the Community Health Improvement Plan as well, but it also overlaps into initiatives that the folks that are around the table can talk specifically to how it ties to the folks that they're working with and how they can take this information and reflect on programs, services, things of that nature. So I might let our partners kind of reflect on where they see overlaps, opportunities with their organization or other activities in the CHIP.
I can talk briefly with DECA. I'm lucky enough to still be able to do some groups with my license, and so I get to work with the women over there. One of your questions was about thriving versus surviving. And many women I've spoken to over there, they say, well, I don't have a home, well, I don't have a job, I don't have anything, I have my kids with me. So I think it's, what some of us may look at as rock bottom, they see as a blessing because they're still able to have their kids with them and haven't lost that. I know in our women's residential program, we've started doing money management courses, teaching them about credit, helping talk about savings accounts, helping them open one if they're interested once they get employment, once they move into that lower level of care and can go out and get a job. In our transitional housing program that we're in the process, it hasn't opened yet, but we're going to be doing credit counseling, money management classes for them as well. I think one thing to think about, though, is many women, and I can just speak to the women particularly, and I started my career at First Step, so I've seen this over the last 18 years, just be a continuing problem. They come, they may be leaving a domestic violence situation. They may be leaving a home where there was substance use, where there was trafficking. I mean, many different stories, and they come and they are in treatment where they, are court ordered or voluntarily there. to complete, and they can't go out and look for a job because they have to be focused on getting better and getting sober so they're able to meet those long-term goals. And having the first month's rent, last month's rent saved up by the time they reach that 28-day mark for them is a goal that's not achievable. So just looking at different things, and we look at, okay, what community assistance can we do? Is there any type of assistance probation can provide if they're on probation, or family support? But many of them don't have that, unfortunately. So
a couple of things about how we're sharing this information. We already had the opportunity to share with Leadership Lawrence in January. So obviously more opportunities like that where folks of our different leaders in Douglas County are meeting to help sort of elevate this conversation. We've also talked about making this information available on a website or digitally so that people have access to it easily to see the information. The point is not to like hoard it, it's to be able to share the information and make it publicly available so that people have access to it. From, I think, sort of a bigger picture standpoint, Live Well, we help convene some of our other CHIP priority areas, such as food security and working in birth outcomes. And so just like Jill said, this information isn't limited to obviously just anti-poverty. It cross connects, you heard in the stories, with all those different topics. So I think that's what's probably the most valuable and impactful is the connections that we have across our CHIP work groups or work areas to be able to leverage these stories. When we were doing our CHIP work to identify the action steps and strategies, right? We looked at a lot of data and we heard from organizational partners about gaps between the data and what the reality was. And then this helps verify those gaps, that what people were saying, okay, now we have the actual stories to back that up so that we're validating the organizational partners as well, so that when they see things, but it doesn't always match up with what the data is saying, right? Then I think that's really powerful and hopeful for us as we move forward.
Brett, do you want to talk about community navigating services was a big one. And I think, what's happening with community navigation under United Way's leadership is really exciting.
Yeah, I'll talk about community resource navigation. This is an initiative that came out of lots of conversations across the community related to some of the access to services, some of those structural barriers, recognizing that there needed to be an individual who could come alongside the individuals who are seeking services. And obviously that's happening with community health workers across the community as well. Sometimes they have limitations on what they can do. And so really thinking about this as a cross-cutting strategy in the CHIP, and also thinking about what kinds of opportunities a particular program like this might create. So the nice thing about this is that individuals who are doing the community resource navigation develop relationships with those individuals who they're serving. And that provides another opportunity for us to be able to elevate lived experience, or what we like to call context experts, who should be in the room sitting right alongside the content experts who are doing this work, and thinking about how elevating those voices might lead to some of those structural or some of those policy changes. What I think is unique about this project is, since Alice came to Kansas more than 2 years ago, this is the first in-depth study that's provided the qualitative data to help us understand the real life experiences of Alice families. We have Alice data for 105 counties in Kansas, but this is the first time that we have this kind of data. And when Jenny was talking about those individuals who were frustrated with wanting to do better and make more money, and then they fall off, that is Alice. That is absolutely the story. In Douglas County, there are nearly 31,000 households that fall underneath that Alice threshold. 16% of them fall under that federal poverty level, which would absolutely be that $10,000 per year in terms of household income. The other 24% are above that ALICE or are above that federal poverty level, but are below that ALICE threshold where we see opportunities for individuals and families to thrive. And so when I listened to the stories, these are absolutely the people that we're talking about. And the federal poverty level is not indexed locally. And so it makes it difficult. And it really hasn't changed much since its development in the mid 1960s. And so for us to have this data is really important. And I think provides an opportunity for us in Douglas County to think really creatively about how we can restructure some of these systems. We are not going to change the federal poverty level at this local level, right? We don't have that kind of influence, but we do have influence in local communities like this to be able to think creatively about how to restructure and reimagine some of these systems and some of these barriers, and think about those policies that we pass at the local level, municipality, county, even state, and think about how we can better provide opportunities for folks to actually have that upward mobility that we heard in their voices that they're desperately seeking. Whether it's an individual in treatment or whether it's an individual who says, I got a raise at my job, I'm working more hours, and now I don't qualify for the housing voucher. Right? That should be heartbreaking to us in our communities when we see individuals who have their sights set on being self-sustaining or whatever thriving looks like for their family. And when they do it, they run into one more barrier. We can't necessarily change things at the federal level, but we can absolutely think about reimagining them at the local level. And I think that's part of the beauty of this. And just to circle back to community resource navigation, another opportunity to engage even more stories of individuals who are doing this and being able to elevate those among the individuals who have resources or have their hands on the policy levers in our community.
So I was going to ask, so what are you suggesting in regards to community health worker policies and changes? Because we know that Kansas already has some policies. And so are you suggesting something at the county level, or are you suggesting advocating for a policy change at the state level?
Both and.
Okay. Or policy change for benefit structures with health plans.
Benefit structures,
obviously,
health plans.
they could do a lot.
Yeah, the opportunities for us to actually get Z codes implemented with insurance companies in order to be able to get the reimbursements for social services that are happening in other states. And I know there's lots of conversation and lots of folks advocating for that. Also opportunities not just for healthcare organizations to get those reimbursements, but for CBOs to be able to get those reimbursements as well, I think would be another good step in the direction for us to be able to scale some of this work, but also be able to find a more diversified revenue stream that would get us closer to sustainability in that piece. In terms of local policies, maybe not necessarily for community resource navigation, but as we're looking at our strategic plans at the county and the city level, to be thinking through some of these structural barriers. And then when advocates bring individuals before governing bodies, for example, to be able to understand that when there are calls for particular policies to come into place, that's absolutely an opportunity for local governing bodies to think through how to create a policy structure within a community where every individual is able to thrive, and to be able to ask even the most basic question, how is this going to affect Alice? Because that's 40% of the individuals who are living in Douglas County, almost 31,000 households. That's a lot of folks from Baldwin to Lecompton and everywhere in between to really think through what those kinds of policies, whether they be housing or whether they be zoning or planning or those types of things, I think would certainly be some opportunities for local governing bodies.
Or when someone exits LMH, that they for sure have a care plan.
Yeah, absolutely right. And to think through at the county and the city level, what contracts you execute with what partners, and how you can use the elements of contractual relationships to provide some of those policy structures, right? So we're not even talking about policy big P here. We're talking about policy small p.
Correct,
Right?
absolutely.
And-
Big
and-
H, big P, little p.
All of those. Yeah, absolutely. So thinking through that at that level, yeah, with that type of lens. Yeah.
Partnering with LMH, but also partnering with the plans. So when those care plans are actually created, when someone does exit a particular system, that those plans are coordinated at the system level, but then at the local level.
Absolutely.
And so what does that look like?
Yeah. So
Who are those entities that are currently working right now
Yeah.
that need to have that coordinated care?
yeah, I think that the community health workers and the community resource navigators are part of that connection and part of that link in the system. But I think that we also, and again, I don't want to speak for every nonprofit in Douglas County, but that requires capacity at the social service level that not everyone would have, for example. And so if there were a policy or a care plan that would require things of a community-based organization in order to be able to provide the social needs to drive health outcomes, there would need to be resources there. And I'm not talking just about money. I'm talking about training and capacity within the social service infrastructure to understand where they fit in that continuum and how they're mutually reinforcing some of those priorities that, for example, a large entity like LMH might have. Does that?
It does make
that
sense.
help? Okay.
And so I'm trying to get to who is meeting now that needs to have these conversations, because these conversations need to happen now. And so because people are constantly coming in and out of the system, and all of you are meeting now, right? Everybody's meeting now. And so I'm kind of trying to figure out who is currently meeting that needs to be at the table and to be having these conversations, and who needs to be invited to the table that's not at the table, because everybody is meeting. Everybody's meeting every single day, in and out of meetings, right? And so who needs to be at the table having these conversations?
Great question.
Commissioner, I would just say, just hearing your interest in this particular area, we can find time to have a follow-up conversation specifically around the work that the community navigation team's been doing.
Jill, I appreciate that, but I don't think it's about a follow-up conversation. I think it's about who is meeting now and who needs to be at the table. We don't need follow-up conversations. We need to get the conversation done.
I think, yeah, do you want to talk a little bit about Live Well in that way?
I can tell you who's in the conversations that we've been hosting. So we've been helping sort of be the convener for community health navigation. So the partners that have been at the table so far have been United Way of Call Valley, Heartland Community Health Center, and Lawrence Douglas County Public Health. So the three agencies that currently have community health workers or community health navigators. So those are the folks that are currently in that conversation, that are meeting on a monthly basis.
Yeah, and I think that there are models within social services that we can think about leveraging here. So we think about the work that's happening in housing right now and homelessness in Douglas County, and the great work that's happening for Built for Zero. There's within that model something called coordinated entry, where individuals, it's a little bit like the no wrong door approach, and for individuals to recognize that when people enter the system, for lack of a better term, they're entering the system, and anyone at any one time should be able to provide services to them without them jumping through a hoop every time they have to do it. And so part of what we're wanting to do through the work that LiveWell is convening with those three partners is to be able to build a network of partners who are sharing information along the way to ensure that people aren't falling through those cracks, and then being able to look at the data and figure out where the highest needs are, and then to be able to triage those in different ways. That's not happening in a ton of communities across the United States, definitely not across Kansas, but it is an opportunity for us to take these three partners to start and to try to think through how we're helping people through that continuum and what that looks like, and bringing in more partners to share data, resources, and information so that those folks aren't coming in one door only to have another door closed, only having to come into the system again and fill out, and so on and so forth. I don't know if that helps.
That's a great example because we heard yesterday in the city commission meeting that for a place for everyone, that work also needs to be better coordinated too, because we have system gaps there as well. And so I go back to, like, I personally don't need a follow-up meeting. I just want to make sure that you all are supported, and that those that are actually getting the supports, that they're not constantly being destabilized and they're not constantly waffling in and out of trauma, and that we are supporting them and that we don't have a siphon that is constantly on, and that we are stabilizing crisis, that we're stabilizing housing, and that we are stabilizing law enforcement, and that you all are not traumatized, that we're stabilizing you all as well. So I go back to who's meeting, how can we get all the people in the room so that you all are supported and we get you moving forward, and we're not either going backwards or we're not staying still.
Kim, Kim Polson, as it relates to navigating DCF benefits, like that's a lot of what happens specifically within the Family Resource Center as well, right? Like I know that that's happening in other community navigators, but I want to make sure that you were able to flag that. That's a huge component of our part of the plan.
Yeah, it's absolutely another one of those transitions that can be seen as very positive and move to thrive when you're getting DCF childcare subsidies. But the trauma that you go through in the process is oftentimes puts you back 2 steps as a result of the challenges. So what we're trying to do is, again, become these hub for applications related to early childhood support services. And so we work with other entities. How can we do this, and how can we do it in one place? And how can our navigators, which we call, which we have peer support specialists and a family support coordinator who do very similar work. It's just different names in our community for a lot of individuals who do similar things. But to make sure that we are training and growing community experts in those processes across organizations. So we have that no wrong door scenario. So we're working towards that and want to have the same thing happening regardless of what a community health worker or a navigator is called.
Getting close to time, so I'm going to check in with other commissioners. Go ahead, Commissioner Dorsey. I saw some folks with microphones earlier, and just make sure we
Time goes fast. The reason I brought up the educational level is a couple of weeks ago we had a discussion on truancy, and I'm suspecting that many of these folks that you're dealing with now perhaps were truant in high school or middle school, or and I think part of the solution is better education.
Thank you. And I'll definitely keep that in mind in our next initiative as important question to ask. Thank you.
Thank you for being here. Appreciate the overview of the report. I know you all are doing a ton of great work out there. And that's, I heard a little bit of what jumped out at you. It sounded like as practitioners, you haven't had this kind of data before. So with this kind of data, I'm interested what jumped out at you. What things did you learn that you didn't expect, or what assumptions that you had maybe challenged by having the narrative data in a different way?
I think for me, seeing on paper that individuals in stressful, chaotic situations still find something positive. A lot of times in the nonprofit social service field, positivity isn't the main thing of the day that you're looking at. So I think hope is a big thing. These individuals, no matter how many times they've been told no or they've had a door shut, they have hope that things will get better. So I think that showed that in some of the responses.
similar thing, but sort of just a fun little tidbit. When I was collecting stories, and I told Jenny this, that when I first looked at the survey, one of the things that I thought was like, oh, this is sort of foo-foo-y, we don't really need this, was the titling of their story. I was like, oh, this is one more question. I'm always like very careful, like how many questions we can ask people. And being able to listen to them, and when they were asked to title their story, like that was the highlight of their, like being able to like provide that was really empowering for me to hear, and just for them to be able to share that story and to give it a title. And they were very proud of it. And they would like, well, can I say this word? Yes, you get to title it whatever you want. It's your story. Was, I think, just like a small takeaway that people want to be able to share their stories, and they have ownership of these, and they need more opportunities to be able to share their experiences.
I really appreciate that anecdote. Thank you for sharing that. And I think it is a small way to empower somebody to, like you just said, take ownership of their story and be able to articulate it in the ways that are meaningful to them, that articulate the positive things, the negative things, the struggles, and the hopeful bright spots. So I think that the way that this was done was really interesting and cool. And it's also doesn't surprise me to hear that social service agencies, as somebody who works at one, feel excited to sort of see this different way of quantified data and this different way to sort of see confirmation of things that we know and see every day in people's struggles, and it manifests in different ways. So I think that that's a cool outcome for service providers too. And what I think, is drawn out in many of these offers some opportunities to, there's some things that are so influenced by structural, economic, state and federal government issues that are, a constant work in progress and sort of constant barriers. So there are some things that feel hard to impact, right? But I think then it's about drilling down to identifying what are the local processes that exist within these different institutions and social service agencies, the service referrals, the talk about the no wrong door approach, and the fact that how do we strengthen our collaboration so that it doesn't become so burdensome for people to access very basic needs. When we know that it has become, and that much of that is driven by state and federal government processes and forms and guidelines and rules, and all of those things are what they are and necessary. But how are ways on a local level we're able to coordinate more effective communication that helps reduce that harm and burden for families? And are there ways to sort of recommend to the local social service providers, most of whom are represented in this project, I think, and are collaborating in all kinds of spaces like the CHIP and A Place for Everyone and elsewhere, that are communicating with each other regularly already? How can this help inform ways to change some of those internal policies and processes within those organizations? Like, what is within their control? What is within organization control, local control, to be able to reduce barriers and minimize harm? I think that, to me, is a real tangible takeaway that I hope is a continuation of this conversation. It's sort of recognizing that there are some things that we got to continue doing, state and federal advocacy efforts and more structural stuff, right, that we can only influence to a certain degree. But what do we have direct control and access and influence over that helps? And I think that that's one sort of starting layer. And then beyond that, what are some possible programs and initiatives that can help really fill in a gap that we can see clearly, and that there are no other resources to fill in that gap? And how can we think collectively about what that might look like locally? Also, I think that some of this information in this report can be really powerful data and information for local service providers to go seek new sources of funding. So either to bolster whatever funding they already receive from local, state and national governments, but also foundation funding, and maybe seek new funding because now they've got something that speaks to these experiences on a collective level, on a community basis, that might be powerful for pulling in more funds to our community that maybe help fund a guaranteed income pilot project, for example.
Commissioner Reed, that's exactly what I told the team yesterday is like, this is their document as well, this report, use it to promote, to make the case for programming for your organizations as well. So same headspace.
We're at 5 o'clock. Commissioners, any other burning questions or comments on top of mind? Okay, I'm seeing any head nods. Any closing thoughts from our guests and community partners here with us today?
Thank you for taking the time to talk to us. We really appreciate it.
Thank you. We really appreciate all the work and the heart that goes into these. And this, I thought the community sense making sort of framework was interesting and really fits these issues well because it is so experience driven and narrative driven. So thank you for all your work and collaboration. I'm excited to see what the information does moving forward. So with that, we will be adjourned until our 5:30 business, I'm sorry, recessed until our 5:30 business meeting. Thank you, Commissioner Willie.